Doll.
Thank you very much. Actually, I would like to thank PBTF for inviting me to this event. And I would like to thank you all for coming and thank all the volunteers and the organizers to help make this such a smooth event. Thank you very much, everybody. So I am a pediatric neuro-oncologist at Children's Hospital Los Angeles. I treat children with brain tumors, and 50% of my time is devoted to clinical research. And the focus for the last 10 years, the focus of my clinical research has been to try and find new drugs and new therapies for our kids who have malignant brain tumors. This is, for most of you may not know, but pediatric brain tumors as a group is the largest, or it's the most common solid tumor in childhood. Pediatric brain tumors as a group, again, is the second most common tumor after leukemias in children. And even though we have made significant progress in the management of brain tumors, and for leukemias, for example, for the most common leukemia, that's the acute lymphoblastic leukemia, we can cure about 90% of these children, but brain tumors remain the second leading cause of death among all our cancer patients. And there is a desperate need to develop new therapies for these kids. Not just that, the therapies that are available to us for treating these kids these days, a lot of these treatments have very severe acute and long-term side effects or sequelae. You know, the children's brains are still developing when they develop these nasty tumors. And when we use radiation therapy, which is part of the treatment for many of these tumors, to these developing brains, so many kids developed long-term sequelae such as learning disabilities, loss in IQ, attention problems, memory problems, and impaired physical growth. These are just to name a few. So we need therapies we need better and safer therapies so that we can actually have a truly cured child. That means that we have a cure without any long-term complications or problems. And one of these approaches that we use is called the targeted therapy. And targeted therapy, just to explain a little bit, so the researchers in the lab studies these brain tumors. They find molecular targets on these cancer cells that make them grow. We then develop drugs that specifically targets these molecules on the cancer cells so we can spare the normal brain. So this, my focus of my personal and professional goal is to try and develop such new therapies. And so is the goal of a lot of researchers around the country, around the world, and at Children's Hospital Los Angeles. The dollars that you help raise today go exactly towards this effort. With philanthropic support through PBTF and many other organizations, Dr. Asgarzadeh, one of our researchers at CHLA, has actually developed a molecular signature that can predict which brain tumors in children can be cured without the use of radiation therapy. Now, this concept we will be trying in the clinical trials in the next few years, but this is where we want to go. One of our researchers, funded through PBTF, Dr. Greg Shackelford, he has developed a mouse model for medulloblastoma, which is the most aggressive and the most common brain tumor in children. This model mimics the disease in humans. This will help us to learn about the biology of this tumor and also help us develop new treatments for this particular tumor. So because of these philanthropic support, because of these efforts through our researchers, we have actually, CHLA is one of the members, is actually in its last 100-year history, it's the first time that we are members of all three large brain tumor consortia that conduct early phase clinical trials. So the early phase clinical trials are where we take drugs that have shown a lot of promise in the lab and in adult tumors, and we try them for the first time in pediatrics. That's the way we learn. If it wasn't for this philanthropic support, we would not have been able to do this. This also brings state-of-the-art new drugs to our patients in Southern California. So our patients who have recurrent brain tumors do not have to go out of state to get these new therapies and new drugs. So with that, I would really like to, I'm actually very pleased to see, and it's really amazing and heartwarming to see so many people come out today who believe in this cause and who help raise funds to support pediatric brain tumor research. I would like to thank you from the bottom of my heart, and believe me when I say that we really, as a medical community, cannot do it without you guys. Thank you very much.
Thank you so much, Dr. Gold.